Julie, the Biden administration making a last-minute push to expand Medicare and Medicaid to cover weight loss drugs like Ozempic and Wegovy. Right now, only patients who are considered obese by their body mass index or have comorbidities like diabetes are covered through Medicare. Here to weigh in is New York City physician Dr. Devi, and she's a star, so she only goes by one name. Dr. Devi, welcome.
Thank you. Happy Thanksgiving.
Happy Thanksgiving. So from the White House, here's the argument for these weight loss drugs. Quote, for too many Americans, these critical treatments are too expensive and therefore out of reach. Medicare coverage would reduce out-of-pocket costs for these prescription drugs by as much as 95% for some enrollees. Doctor, what is your assessment?
Well, there are a lot of issues to consider. I mean, first is the benefit, right? That if we had more weight loss, that some of the obesity-tied conditions like high blood pressure, high cholesterol, diabetes, arthritis, all of those things might potentially be better. I mean, I do see benefits in patients who are on it where they're not reporting as much low back pain. And maybe that could help them in terms of the cost of treatment for those issues and help them to also be more productive and have a higher quality of life. But then that has to be balanced, too. So RFK Jr. has expressed some concerns because, well, first, we see the short-term benefits more quickly than we see the long-term harms. So that's something that has to be assessed between the doctor and the patient as well. But then the cost and the culture, that we're more focused perhaps on drugs rather than the things that might help more in the long term, like a healthy diet and exercise. I think these two things can coexist. They're not necessarily mutually exclusive. I mean, we should focus on those things and we should consider, our overall culture. But I think the greatest risk here is really to the taxpayer, maybe, as opposed to health. How much is this going to cost? Because right now, the reason people can't afford these drugs is because they're priced so highly. But that price could still get transmitted to the government, whereas in other countries, the price is significantly lower. And that still hasn't been explained. And whenever you have a price difference, you have more opportunity for counterfeiters and diversion. And that needs to be looked at because we've seen that with opioids, amphetamines, a lot of other drugs.
All right, I want to squeeze in another topic. The CDC is warning that whooping cough is surging in this country, up substantially over last year. Basically, 25,174 cases so far in 2024 compared to 5,371 last year. How concerned are you about that?
It is concerning when you see such a surge. I mean, it could be from a few different factors. First of all, we have a vaccine for pertussis, which is the other name, and people miss that during the lockdowns often because they couldn't get to the pediatrician or the doctor. We also have, illegal migration. So you have people who might not be vaccinated coming into the population. And you also have, as things open up, which we want them to, you have maybe more mingling and more potential for spread of pertussis. But the main thing is if you have a terrible cough, any trouble breathing, you want to get checked out, but maybe call the doctor or urgent care first because it's highly contagious. If you go there, more risk of spreading it to others.
Great advice, Dr. Devi. Thank you so much for taking time out of your Thanksgiving to give us some good medical advice. We appreciate it. Have a wonderful day.
You too. Thank you.